Hi, I'm Terri Ford, the Chief of Global Policy and Advocacy for AIDS Healthcare Foundation. And I'd like to welcome all of you joining today for our webinar on the importance of a COVID-19 conference in the Americas. I'd like to introduce our two panelists who are leading this conference. And the first is Dr. Jorge Saavedra. He's the Executive Director of AHF Global Public Health Institute at the University of Miami. And also Dr. José Zuniga, who is the president of the International Association of Providers of AIDS Care, IAPAC. Welcome both of you, and welcome all of our audience to our conference on the Americas. Just like to say a couple things to start, and one is that we all know that COVID-19 has turned our world upside down. Those of us that were focused on fighting HIV/AIDS full time and have been diverted to fighting COVID, while we're still keeping HIV/AIDS care and treatment going. Across the Americas, we've experienced the most impacted region by COVID-19, North, Central, and South America, an area that currently accounts for approximately half of all the coronavirus cases and 60% of all the deaths globally. So that's what we want to focus on with this conference. I'd like to start with a question for Dr. Saavedra. Just to get us going, can you give us a full picture of COVID-19 in the Americas currently? And is it truly a critical situation?
Yes, thank you very much, Terry, for the introduction. Thanks to IAPAC and the University of Miami Institute for Advanced Study of the Americas for co-organizing this conference together with the AHF Global Public Health Institute at the University of Miami. So I'm going to start by sharing some slides just to highlight the situation in terms of numbers on how it is impacting COVID-19 in the Americas and why we decided, the three organizations decided that it was really needed to have a conference focusing on the Americas. So I'm going to start sharing my screen. So I don't know if you can see my screen now.
Yes, we can.
Okay.
Go ahead, Jorge.
Okay, so what's the situation now? Until yesterday, because I prepared these slides yesterday, the situation was in the Americas, that means North America, South America, Central America, and the Caribbean. There were 19,852,092 cases, cumulated cases, almost 20 million. I mean, in the next 2 days, we will get to 20 million just in the Americas. How it is growing, this is the incidence, daily incidence of cases. The peak of cases in the Americas was on July 29th. There was 176,525 new cases just on one day. That was July 29th. And then they started to come down a little bit, and then again, going up, raise again. So yesterday, there were 131,695 new cases. So this means it's not under control. And very likely, we will see resurgence again of cases in the coming days or in the coming weeks, as it is happening in the case of Europe. And then when compared with the rest of the world, how the Americas looks like. So the Americas, as you can see on this chart and also on this pie, Americas concentrates 46% of all global cases. It was a little bit different just a few weeks ago, but Europe started growing again. Now Europe is number 2 with 22% of cases, Southeast Asia 21%, Eastern Mediterranean, that includes the Middle East, 7%. Africa is not that affected as many of us expected like a few months ago that Africa was going to be hit hard. It looks like it is not. And in the case of Western Pacific, that I must include that and highlight that Western Pacific includes China, mainly China, is what is the less affected region of the world. That means where China is the less affected region of the world. So in the case of deaths, even is harder hit the Americas. It's not 46% as we say in cases, but 54% the death of the deaths for COVID-19 are in the Americas. That means we're dying more. And let's go inside the Americas, how the distribution is. Well, Latin America and the Caribbean has 55% of all cases, and USA is 44%. I split there, Canada is just 1%. Inside the Americas as well, the deaths is almost also is happening the same, that with the Americas compared with the rest of the world, that Americas had more of the most of the cases. In the case of the Americas, inside the Americas, is mainly Latin America and the Caribbean that concentrates the deaths. That means 62%. Of course, if you concentrate the population of Latin America and the Caribbean, it's more than the USA. But anyway, it is more impacted. In Canada, it's just 2% in the case of deaths. So we have comparative data of the Americas on the country by country basis, and you can find it on these sites, either in English, Spanish, or Portuguese. I'm going to stop here. It was just numbers, and later I can address some other issues related with the Americas. So I will leave it here. Thanks for the question, Terri.
Jorge, were you going to address at some point the Canada issue? Like many people ask if it's so bad in the Americas, but look at that, just that little sliver of Canada, which is a big part of the America. Why is Canada doing so well, or just not doing as badly as the rest of the Americas?
Yeah, well, the main point here is the population. I mean, Canada is big in terms of territory, but it's small in terms of population. Not most of the countries, but several countries in Latin America have more population than Canada, like Brazil, Mexico, and Colombia. They do have more population. However, it looks like they are doing well. I mean, in terms of cases, it's just 1% Canada. In terms of deaths, it's just 2%. And very likely they are doing well in terms of policies. I don't have right now all the explanation for Canada, but it looks like they are doing not bad.
Yeah, okay, great. Thank you, Dr. Saavedra. Dr. Zuniga, wanted to ask you about IAPAC and your involvement in here. And I know that IAPAC's primary mission is to end the HIV epidemic by 2030. I think it's all of our goal. Tell us why IAPAC is partnering with the HF Global Public Health Institute overall and the Institute for the Studies of the Americas, to focus on COVID-19, specifically in the Americas.
Thank you, Terri, and hello, Jorge. It's a pleasure working with you and the AHF Global Public Health Institute, as well as the Institute for the Study of the Americas at the University of Miami. We by necessity, as a professional medical association, have had to mobilize and deploy resources to address the COVID-19 pandemic. It should not be surprising that a sizable percentage of our membership has been repurposed for COVID-19, particularly in the early days of the pandemic. And so when we're dealing with a new pandemic that already accounts for 43.7 million cases globally and almost 1.2 million deaths globally, it was a no-brainer for us to be engaged. Actually, it was a moral obligation to do it. But specifically in relation to a focus on the Americas, you both have already articulated some of the numbers here in relation to cases in the Americas and deaths as well. But if we were to drill down into countries specifically, I think we're interested in looking at the variety of ways in which COVID-19 is affecting the populations of the Americas from a country perspective as well as a city perspective. If we look at the United States alone, as Dr. Saavedra indicated, we have 8.7 million cases and more than 200,000 deaths as of today. You have Brazil almost in the same boat with 5.4 million cases and 157,000 plus deaths. And that speaks to, in our mind, a lack of leadership and coordination that I think is not present in many other countries that we'll be hearing from throughout this conference. as important, I think we want to engage in these discussions because at the same time that we're trying to ensure that the COVID-19 response is robust, we want to ensure that there's a continuity of HIV services. And unfortunately, we have documented HIV service disruptions globally. For example, around HIV antibody testing, 35% disruption, ART initiation or antiretroviral therapy, 25% disruption, laboratory monitoring, viral suppression, 46%. Overall global disruption, PrEP initiation, case management, I could go on. And so we want to ensure that as we're speaking about COVID-19 and its response, that we're integrating into it the importance of continuing the response to HIV as well as TB and viral hepatitis, where we've also been documenting disruptions. Ultimately, our goal should be to get back on track for SDG 3.3.
Thank you. I know it would be absolutely tragic if we lost all the groundwork that we've all built to stop HIV/AIDS and other diseases as well. Back to thank you for that. Back to Dr. Saavedra. Actually, now let's talk a little bit about this conference because it's interesting. It's not the average conference that is 6 months. And also, it's not in a normal world of virtual. So, we're in a new world. So, tell us a little bit about this virtual Americas conference, and also maybe it's going to be 6 months, and do we even know where we're going to be in 6 months with COVID? Another thing that you may both want to address is a question that has come in. How will this conference? How will you try to unite the diverse countries and political leaders, of the Americas, to fight COVID more effectively? So Jorge, tell us a little bit about this conference and what the goal is and, some of those ideas.
Yes, thank you, Terri, for asking me this question. So the idea came because first, as I mentioned it before, it is about the numbers and how the Americas is being highly impacted, the most impacted region of the world. But the second point is that COVID-19 is impacting and affecting everything, every single aspect of life, not just health, not just the medical area, but every single aspect of life is being impacted by COVID-19. Therefore, everyone has something to say during this pandemic because everyone has been affected. That means that we are thinking on the medical care, hospitals, intensive care, but not just that, is everything else, schools, universities, restaurants, theaters, mass transportation, airlines, airports, whatever is in this world happening is being impacted by COVID-19. And this new normal that's being called new normal, it is about the new reality that we are adapting to a new reality and we are trying to make it work. But making it work, the economy is really impacted, not just in the United States. I know that in America, in the United States, people think that is the worst part of the world, but not necessarily is that the worst part of the world. It is very hard hidden, but there are many countries suffering as well. But we don't know about them. We don't know the news. We don't hear what they are doing. We don't hear what they are suffering. We don't know what they are expecting the rest of the world to do. So sometimes we ignore what is happening in the rest of the world. So what we say is, okay, it's time for us in the Americas to learn from each other. So sometimes probably Mexico can learn things of what Chile is doing or Peru is doing, but Peru is also hardly hit. So I would like just to share for a few minutes, a couple of minutes, another page that we developed for the situation of the Americas. But before that, I'm going to share what the structure of the conference will be. So I'm going to share it right now. Hopefully you will see it. Okay, I think you are seeing a graph, but that's not the one that I want to share. So We are having this conference in 3 languages. We are going to have it in English, so panels in English like this one, but we will have panels in Spanish and we will have panels in Portuguese. So we are starting with 4 panels this week. The first one is this one that we are right now addressing about the importance of the conference in the Americas, COVID-19 in the Americas conference, and why are we highlighting these issues. The second one that is coming just after this one is about rethinking everything. It's a panel that will be addressed by President for the University of Miami, Julio Frank, who's also a former Minister of Health of Mexico, and also by Michael Weinstein, President of AIDS Healthcare Foundation, which is the largest HIV organization in the world, and it will be moderated by Felicia Now, the Director of the University of Miami Institute of Advanced Study of the Americas. By the way, I need to let you know that there was some information there. Some mistakes saying that Felicia was going to be on this panel. That was never the intention. It was a mistake. So for the audience, just in case you were expecting to see Dr. Now here, she will be on the next panel and she's the moderator of the next panel. And then we have another panel coming on Wednesday, October 28th. That means tomorrow. And it will be about sexuality and COVID-19. And this is getting a lot of attention because, you know, sexuality issues always are something to look at. Sometimes we don't know if sexuality is increasing or decreasing, if sexual transmitted infections are increasing or decreasing. So many aspects of sexuality will be addressed tomorrow of people who are being studied what is happening with sexuality during the current pandemic. And then we have another one more medical oriented. This will be in Spanish. It is about intensive care during the pandemic of COVID-19, because intensive care is also changing the way intensive care used to be, especially because the massive influx of patients into intensive care. So that's the structure. And as I say, together with IAPAC and the Institute of Advanced Study for the Americas, we developed some tracks that we want to address. These are indications of different panels that are coming soon during the next 6 months. As you mentioned, Terri, this is an open conference that will last during 6 months until March next year. And we will address like La Peste in COVID-19, public health, social drama in 5 axes, the wording that Jose suggested to us. It was about ignoring the clues, reluctant recognition, demand of explanation, responses, effective versus failure, resolution, societal action versus herd immunity. We have a track on science, of course, natural history, epidemiology, vaccines updates, and not just updates, to see discussion if vaccines is the silver bullet that everybody is expecting. A therapeutic update like the one we are having this week on intensive care. Then we have another track on clinical management, and that means comorbidities, endemic conditions, clinical case series, innovations, trauma. We have another one on mitigation measures like face masks, social distancing, quarantine, contact tracing, lockdowns. We have another one on politics of leadership versus demagoguery, politicizing data, public health messages, prioritizing economy over public health. And many of the issues are being right now politicized because politics has also been changed because of COVID-19. We have another one on sub-regional case studies, what is happening in Brazil compared to Canada, Mexico, or United States, the Andean countries, the Caribbean, Central America, Southern Cone. We have another track related with cities, what is happening, for example, in Atlanta compared to Buenos Aires or Kingston in Jamaica, or Mexico City, Sao Paulo, and some other cities of important nature, what is happening there. Also, the social impact of COVID-19 in terms of vulnerable populations, because there are many communities that are being very vulnerable, and they are the most affected ones: homelessness, food insecure, sex workers, gender-based, domestic violence. So there are many things coming on track 9, also online, in person, and hybrid work environments that we are all facing: intimacy, sexuality, as I mentioned it before, culture, entertainment, sports, Hollywood. In track 10, under employment, GDP growth, stock markets, winners and losers, restarting national and urban economies. And track 11 is that have a big, large list of issues related with lessons learned from COVID-19, from surveillance, from investigation, from emerging pandemic preparedness, implementation of courses. And then in track 12, we will have related issues related to governance of health, the United Nations, the nation states, the city multilateralism, and also new global public health convention will be addressed. And just started mentioning, Terry, we are working on that issue with different partners from different universities and different people, mainly parliamentarians at the global level. So all those issues will be addressed during the following months. So that's why we feel really excited about this conference. And I think I'm going to stop it there, and later I will share the page that I was talking about comparing numbers in the Americas. Thank you.
Okay, well, thank you, Jorge. First of all, I think that everybody who just saw that sees that we need 6 months to cover all of that, and it's a wide variety of things. And I am already thinking about interesting speakers that you could have on there that actually might have diverse opinions, and I'm sure there's going to be some really vibrant discussions on a lot of those. And I also feel good that it's in the hands of IAPAC to organize and keep it going, because you do so well with conferences. The pros on that. So I'm excited about it. And who knows what, by the time this conference is over, it's 6 months, where we're going to be in 6 months. So thank you, Jorge, overview on that. Dr. Zuniga, I want to come back to you, a couple questions on the same track. And beyond your role, in the program development and logistics support for this conference, which I think is great. Like I said, we're happy you got it. Is what is IAPAC's aim in promoting this 6-month virtual series of discussions to your broader membership, which I know Fast Track Cities is a primary focus of yours, and how does it all play into that, and how do you see it in the bigger picture?
Well, first of all, let me say that it was exciting to work with both Jorge and Felicia on the tracks, because it not only allowed us to flex our public health muscles, but also to think about COVID-19 from a holistic perspective that we're all living through at the moment. Every aspect of our lives, as Jorge mentioned, has been affected. And in that respect, a conference that attempts to address as many of these different impact points as possible, share best practices, and speak to some of the challenges that we're going to have, not only as we get closer to a vaccine or vaccines and therapeutics, but also how we get out of this period of darkness that we've all experienced, of isolation, how we regain a sense of being social again when we've been asked to be distant for so long for our own sake and the sake of others. But in relation to your question, our aim in promoting this conference through our membership of 30,000 clinicians worldwide, as well as our network of 300 plus fast track cities, is to ensure that the experiences that the Americas are having in relation to all these various issues are given proper attention, particularly those countries and those cities that get very little attention from the media. Jorge also referenced the US seems to capture the limelight as far as media coverage of its pandemic response, and God knows that that is appropriate in many instances. But I think we need to hear from many more countries about the impact, about the innovations that have been put in place, about some of the ways in which those innovations have helped to mitigate additional harm, or even created a space for people to be human, to be in room together or outdoors together enjoying each other's company and never forgetting that we are a global community. But I also think that from our perspective, if I look at fast track cities, I want to ensure that the perspective of cities and municipalities is reflected throughout the scope of the conference. And in that regard, I think it bears noting that my primary reason is that we have seen many nations fail to lead. And in that failure deficit, that deficit has been filled in many respects by mayors, governors, and others at subnational level who have taken on a global mandate to address something that is transnational. And so I'm excited about that aspect of our conference and our work together, and really promoting the idea that national health diplomacy really should be working hand in hand with city and municipal multilateralism.
Mm-hmm. Okay, and it sounds like part of what your the outcomes that you want for this robust dialogue is beyond, you know, morbidity or mortality. It's how it's affected all of us in our lives, and bringing those qualities back as well. Because what we constantly just see is the numbers. But you're right, we don't talk enough about all these other things. So I think that's really important, and you outlined that. What can I just come back to the question to both of you? How do you think you'll be able to unite the diverse countries and these diverse leaders in the Americas? Because Jorge, you did tap on, there's a lot of politics involved here. So do you feel that this conference is going to be able to bring them together to overcome differences, or what are your thoughts on that?
Yeah, we have started to contact some of them, and we will continue to use these approaches to different members of governments of all the Americas. And the idea, we have already contacted some of them, including the US government, and they are interested on this conference. The only thing they told us probably they will be more interested after November 3rd, but they told me so. Well, anyway, that's especially for the US case. But we have also the contacts with different governments in Latin America. But I think the main reason here is to share experiences, to learn from each other, to know what is happening inside Brazil, for example. We are right now preparing a series of panels in Portuguese, but they will be addressing what is the situation inside Brazil, because Brazil is also a federal country, and that means a lot of the states, they do their own strategies. They are achieving different results. Same case for Mexico. In Mexico, there are 32 states, and they are performing differently, and that needs to be learned as well. Not just about the national strategies, but also about the sub-regional level and also at the local level. As Jose also mentioned, it even to the city level, which will be like at least the minimum administrative level that the people can organize and responses closer to the communities. But in the case of sub-regional strategies, I think that's also needed. And I don't know if I can share my screen right now just to show you quickly one site that has some comparisons here, and I'll do it right now. So this is the one that I want to share. Okay, can you see it now? Can you see it?
We can see it.
Okay. So this is a website. It is only for COVID-19 in the Americas. And what we have here is the total cases that has been updated every day. And then you have the list of countries. And in this case, the order is by cases. And as you know, the US has the most cases on a country by country basis, then Brazil, Argentina, Colombia, and Mexico. But then you can also compare by deaths, and then you just click on deaths, and then the order is different. That comes the US, again, first ranking number first, and then Brazil, and then Mexico, not Argentina, not Colombia, but Mexico in terms of deaths, then Peru, Colombia. But then if you go to fatality rate, that's a different story. Fatality rate means the ones dying that were diagnosed. So that means it's not just cases, it's not just deaths. How many deaths? What's the proportion of deaths among the cases that were diagnosed? And in this case, what you see is Mexico comes first, and then Ecuador, and then Bolivia, and then Canada, and then Peru, Guatemala, Colombia, Guyana, Barbados, Brazil, El Salvador. So if you see it on fatality rate, uh, the US is not on the top 10 here. So, but then if you go cases per 100,000, which is kind of also known as cumulated incidence, or in some other chronic diseases that you call it prevalence. So here, what you have is the most affected one in terms of cases per 100,000 is Panama. It's not Mexico, it's not Brazil, it's not the US, it's Panama, the one with the most cases, taking into account the size of the country. And then comes Peru, and then Chile, and then the US. And then if you go tests per million, you have a different story. The most affected one in the Americas, but also in the world, is Peru, is where the people died the most from COVID-19, taking into account the size of the population of Peru. So that one ranks number first. And then we also have the data on the tests per million per day. And that means there are some countries that are not testing enough, and sometimes that's reflected in the cases. It's not that the test give us an idea of how many infections are being there, but at least the ones who are diagnosing the most. And in the case of tests, yes, the number one is the US, then Canada, then Chile, Panama, Uruguay, Cuba, Colombia. And as you've, Mexico was always on the top, but not in the case of tests per million per day. Mexico is kind of on the bottom, just with 83 tests per million that they perform, because they have a different kind of way of the standard to apply a test. They only test the ones who are very severe cases that need hospitalization. So that's why the differences between countries. And these things, they need to be learned from each other, know about the policies being implemented. And I think that's a good example on how can they learn from each other in the case of the Americas. So I will stop here sharing here, and I will leave it there.
Thanks. Thank you, Jorge, for that picture. That's we just awarded Panama an emergency COVID grant this week, which I'm glad we did that, because it's number one. But Jose, I wanted to go back to you on the question, because I think you deal with a lot of politics with this, with the fast track cities. You deal with mayors and governors, and you know, who are in opposition actually to the national leadership, and you're dealing with cities. So I'm just trying to figure out how do we pull these leaders in the Americas together to overcome, you know, their own sovereignty, their own, you know, like Mexico, you know, not testing nearly as much as other countries. How do we get Mexico to, you know, follow the lead from other countries? And what is your experience with those kind of politics, Jose?
Yeah, thank you, Terry. I think, you know, in many respects, what we've experienced over the last several months is that if you create a forum for people to come together to speak to the challenges, the barriers, the opportunities, beyond looking at data, they will come. They're anxious to have these conversations because they need to feel a sense of solidarity within their regions and globally that unfortunately has not really been the case for a while, particularly for the Americas. I think we've witnessed over many years the Americas get the short end of the stick as far as attention to public health and other sustainable development issues. And in many respects, perhaps the chickens have come home to roost. If we look at the results or the outcomes of the COVID-19 pandemic, the data of COVID-19 in the Americas versus Africa, where a tremendous amount of investment has been made in public health systems, et cetera, to the benefit of people in those countries. I'm not saying that the lack of focus that we've seen in Latin America and the policies that have created, such as the World Bank's policy on low and middle income countries and the way they define them. I'm not saying that that alone explains the numbers in much of the Americas, but it certainly contributes. And so I would hope that as we bring these leaders together, and I would say leaders are well beyond the politicians, because in many respects, we're all politicians. We all, in some way, influence the direction our countries and our municipalities head in through our vote. And so I'm hopeful that by bringing folks together, we can have these honest conversations. And I think, too, that the three co-sponsors of this conference have truly committed to ensure that we bring on board moderators like you, Terri, who are going to keep people honest. And if we start hearing data acrobatics or verbal gymnastics, we get back to the core of the issue, which is how are we going to get past the various challenges we're facing with COVID-19 that extend well beyond morbidity and mortality, although that rightfully should be our focus at the moment.
Thank you. Yeah, thank you, Dr. Zuniga. I really, I'm hoping that the rest of the sessions are rich with, honest discussion, and that people do challenge each other and question, if they don't agree. I think that's the only way to have a true, honest and fruitful dialogue. And I think that's what's going to happen. We don't have that here today because all three of us are in agreement, I think, on most everything. But I have a question for both of you, and in bringing it back to the overall conference, so people can get an idea. Many of us in the AIDS, HIV/AIDS world, we experienced the first I think it was the largest first virtual conference, which was the International AIDS Conference in July, and it was bumpy, but we all made it through. And so I'm just saying that because these virtual conferences aren't easy. They sometimes they lack human and social interactions that we have in in-person conferences, but we make the best of it for the highest impact. So really, how I want to ask, how will you bring people together during this virtual Americas conference? Overcoming language barriers, many of those, and virtual limitations. And what makes this conference particularly interesting compared to so many of the other webinars and things that people can tune into? How is this conference? How are we going to make this conference have a human factor to it as well? In the virtual world.
Yes, I think there are several advantages of this conference. First, it is free, and you don't need to pay to get
That's a good one.
Here. You register to the IAPAC website, and then you can join. Secondly, they will be recorded, so that means that they can be played later. We will share the program of replaying online these conferences. And the ones that are pre-recorded will have translation, but it will be with subtitles for the ones pre-recorded. But we will have full panels discussed in different languages. Those ones we will not have online translation, but they will have subtitles translation later when they are replayed. And that means we will have conferences in English, in Spanish, and in Portuguese, and very likely also in French, because we have two countries, at least two countries that have French as a major language or the main language, which is Haiti and also Canada. But there are some other Caribbean islands that also have French as their main language. So that is open as well. So right now we are involving people from all over the Americas on organizing these panels, and they are very engaged. They are very close to the communities. So I really think there are several advantages here. It will last during 6 months. That means you don't need to be like doing 3 full days trying to get all the panels that are happening at the same time. And sometimes you cannot get into all of them, and then you need to reprogram your time. So those advantages that having a virtual one is part of the new normal, I think. But I think Jose has more experience on organizing everything in terms of conferences, so he will.
He does have a lot of experience. So Jose, what's going to be your trick here to make this conference a great conference?
Well, first and foremost, I think the program itself is extremely attractive, or should be extremely attractive to delegates. I mean, this is not a medical or public health conference. As you've viewed the tracks, this is a human conference. It speaks to every aspect of our lives that have been affected by COVID-19. So from that perspective, I think that there's going to be a wider level of interest than even the conferences that we have been hosting. And IAPAC has hosted 3 virtual conferences this year. They're not easy. I don't like this as a new normal. I don't think any one of us does. The idea that we can't be with each other, give each other a hug, network, have coffee, a glass of wine, laughs. I mean, that's beyond my definition of being a human and a professional one. But we're also looking at other innovations. So the beauty of this virtual conferencing modality is that the platforms are evolving. So as they evolve, we will evolve the way in which the conference is being delivered over the 6-month period. But as Jorge rightly said, all of the sessions are being recorded. They will be archived and available for anyone at any time, free of charge, to access, to learn from, and to hopefully apply any lessons learned from those sessions to their own situations.
Okay, great. Okay, now I think maybe why don't we kind of wrap up this humanitarian and economic, crisis of COVID-19? Is there hope? We want to, when a disease reaches one nation, it spreads to all nations very often. And, is there hope that we can contain that? Is there hope if we can all talk about these issues that this conference is going to cover, that we can overcome this better and stronger? And basically the last question, is it time for all nations in the Americas and beyond to come together to promote what you referenced before, Jorge, possibly a new global public health convention? And if so, what would that look like? And is this conference going to be able to get into that?
Yeah,
I'll give you both the last thoughts on that, the bigger picture.
That of course, the Americas is part of the world. So this idea of having a new global public health convention is not to substitute the World Health Organization. It's nothing like that. It's like to have a framework, a bigger agreement where all countries agree to certain principles in what role each one of their global organizations should play, like the WHO, like the Global Fund, like UNICEF, like many others are there, UNAIDS, UNITAID. There are many organizations, there are international organizations that need to play a role, but what is the role that they need to play? There are the international health regulations there that cannot be enforceable, that countries mainly voluntarily agree to apply. But there are some other examples as well, like the World Trade Organization. Is the trade rules in the world, they are not voluntary, they are all enforceable. In countries that are not comply with international trade regulations, they are subject to sanctions or panels, and they are accountable of what is happening in terms of trade. Same thing for international financing, same thing for international air traffic, same things for nuclear energy production. They are obligated to follow, and there are ways to obligate countries to do so. But there is also an example, a positive example, like the Global Fund to fight AIDS, tuberculosis, and malaria. They use the incentives approach. They give resources to countries in order to do the right things. And then the countries, they need to comply with certain rules, like this is my global plan, my national plan for HIV. This is my national plan for tuberculosis or for malaria. And these are the objectives and the goals I want to obtain. And I will provide all the information in order to get that incentive that the Global Fund provides to countries. So that's a good example of how to do it, not with sanctions, but with incentives. So there are examples, global examples that can be used in order to have this new global agreement and to upgrade health, global health, to top number one priority, that clearly it has been not. If it weren't because of COVID-19, right now there is a top priority, but because of the pandemic, but it was not like that before, but it needs to be now. And I think COVID-19 is a good reason to think this way.
Yeah, and I know that we've brought our advocacy, many of us, to the G20 and the C20, to put this on, as a priority, particularly health. It's always kind of surprising when health is not on the high priority list of the G20, and it needs to be. But Jose, do you have any thoughts?
Yeah, thanks, Terri. Just to add on to what Jorge said, I think it's clear to us that most national health systems were able to mitigate the emerging pandemic preparedness shortfalls that were experienced by most countries by leveraging the infrastructure and resources that were designed for other more mature pandemics such as HIV. And what that has resulted in, that leveraging is becoming increasingly clear to us, the disruption in access and utilization of HIV services. And so, I think there will be people who will say, well, we have the WHO, we have the international health regulations from 2005, but I would argue that while the WHO should play an important role in pandemic preparedness and response, there are certainly deficiencies that have been identified, and that it is itself finding through its own evaluation of the way which has handled COVID-19. And in relation to the international health regulations, I mean, there are 13 critical capacity areas, and countries have self-reported abysmal levels of preparedness with 13 capacity areas. And so, largely because it's an unenforceable document. So I think we need something like a global public health convention for the 21st century that really prioritizes how countries, and as important, subnational jurisdictions, prepare for and respond to new pandemics, emerging pandemics, so that we don't find ourselves here 2 years from now, 3 years from now, 10 years from now. It's unconscionable that we should ever be in this place again.
I totally agree. We could have learned so many lessons from Ebola. There were so many recommendations that were not, a few were applied, most of them were not. And now here we are today, and you're absolutely right. We do not need to be here again. And it is a crisis, and it's time that we all come together to solve this so this doesn't happen again. If it's okay, we have 2 questions that are coming in on the chats. If you're willing to take them, we have a couple more minutes. One question is for either of you. Why are countries in Africa not part of any news or report on the number of cases affected by COVID-19? Africa is not mentioned in any of the news. What do you think about that?
I do think that is right now, because I showed some graphs, is that Africa is not the most affected region of the world. It's one of the least affected regions of the world. That's good news. I mean, and sometimes good news don't make it to the mainstream. People don't read the good news in the international media. They usually read the terrible news, and that's the good part. I mean, except for South Africa, that is being severely affected, but the overall African continent is not. And South Africa is not that much on deaths, it's on cases. So I think that's the main reason why we don't hear much about Africa, like in the case of HIV, which is a completely different story, where Africa is by far the most affected region of the world. So I think that's the main reason that good news usually don't make it to the mainstream.
I think, I agree with Jorge, of course. South Africa is probably the most affected country on the continent, with a little over 700,000 cases. But it's sad that we're not seeing a focus on the African continent, because in many respects, we do a tremendous amount of work with fast track cities in all of Africa. And we are witnessing, as we have in the HIV response, a level of resourcefulness and dedication to ensure that HIV services and TB services are continuous. And even though we've noted disruptions, I think we're not hearing that good news. We're not hearing the good news that the investments that have been made in the health systems in those countries not with some exceptions, that those investments have been put to very good use. And I think that's an important story to tell. And it will be an important story for us to tell as an HIV advocacy community as we face a round of decisions about resources for the HIV response. Why should parliamentarians invest in the HIV response? Well, if they hadn't invested in it and we didn't have the infrastructure, I guarantee you many more people would be dead today.
Yeah, I agree with that. Last question here. It's actually a good one. Somebody writing asking how they can help and they want to volunteer for this conference and be a part of this 6-month innovation.
I didn't quite hear the question.
Did you not hear the question? That somebody the writing in the chat asking how to help volunteer and be a part of this conference in any way they want to make it happen. Who do they contact?
Yes, I think they can always volunteer by spreading mainly the e-blast and the information coming from either IAPAC or the AIDS Healthcare Foundation or the University of Miami. That will be of great help if you can spread the news that this conference is happening and where to register. And I think, and by highlighting some of the panels. Right now in this virtual mode, I think that's one of the best ways to do it. The other way, in case of the local chapters of AHF in some countries in Latin America, they are already working on some ideas on how to develop some of the panels and contacting potential speakers and moderators. So we are welcoming those kinds of potential new panels that will come. And as we said, it is until March next year.
Okay.
I would add one additional way in which you could help, and that is send us information from your country or your city about any of the topics that were included in the various tracks, the 12 tracks. They're up at iapac.org. We would love to hear from you. And even if we don't wind up integrating what you're sharing with us into the conference program, at a very minimum, we can ensure that we're collecting those best practices or innovations and sharing them broadly within our respective networks.
I think that's very important what Jose just said, because we need information from the ground. We get get reports from Geneva or Washington or wherever, and that information is not from the ground. It's not the reality. So please send us that. I second that, and also please help us get the word out any way you can. Spread it. We want to have the widest audience to share the incredible dialogue that's going to be happening over the next 6 months. So with that, I want to thank both of you for introducing us to this conference, where everybody's excited about it in the Americas and across the world. And I invite all to, we're going to take a little break. We have a 5-minute break before we come into our next panel, which is going to be great. So if you're online and you want to stay on, just take a 5-minute break and come on and get acquainted with our first panel of the conference following this introduction. Thank you, Dr. Zuniga. Thank you, Dr. Saavedra and the team that made this happen. And we're taking a little break. Thank you so much.
Be safe.